everybody. I will be covering the controlling and staffing portions of food management service. So the first thing when to do with controlling food service management is evaluating work performance of the employees and of the establishment itself. So the first thing that needs to be done is to establish standards. So for standards to be effective, they need to be based on formal goals of the organization, and they need to be identified and developed during the strategic planning process. The specific details and the factors within the standards are referred to as productivity, and these details can be objectively measured and involve quantity, quality, and time factors. So a big question when establishing standards are, should they be qualitative, quantitative, or both? The answer is they should be both qualitative and quantitative. Next step is monitoring established plans. So monitoring plans include measuring performance and comparing that performance with already established standards. Measuring this performance is an ongoing process, and it depends on a number of different factors, including observations, verbal and written reports, and quality control tests. These help show where there are strengths and weaknesses and how we need to solve the problems. And from here, corrective measures can be implemented. So the last step in evaluating work performance is developing corrective actions. This should only be considered after all the information has been presented and analyzed in an efficient and timely manner. So when it comes to taking corrective action, there's a couple of different levels of what kind of corrective action should be taken and when it should be taken. So if the performance is only slightly higher or lower than the standard requirements, no corrective action is necessarily needed unless it's deemed needed by the director. If standards are found to be unrealistically high or low, appropriate action should be taken to change the standards to reflect a realistic work situation. If the problem is the work performance of an individual, the director needs to determine if that employee needs to be retrained or needs counseling on their specific tasks. If the issue has to do with equipment, that's the reason that standards are not being met, the equipment needs to be repaired or maintenance procedures need to be improved. And then finally, if the reason that standards aren't being met is due to poor supervision, inefficient procedures, or inadequate staffing, then the director needs to take immediate action to correct these management-related problems. So as a manager, a question that's commonly asked is it better to evaluate employee performance once or ongoing? The answer is it's better to evaluate the performance ongoing, because this will allow you to see what areas of performance an employee has improved upon, and then what areas they may need retraining to meet those standards. So the next section is staffing. So to determine staffing needs, establishment needs to determine how many meals per labor hour are produced. So here are a couple of examples of how many meals per labor hour are produced in the following settings. So in acute care conventional setting, 3.5 meals per labor hour are produced. Extended care facilities, 5 meals per labor hour produced. In a cafeteria setting, 5.5 meals per labor hour. And then in the school food service, 13 to 15 meals per labor hour are produced. So how are these meal equivalents determined? Well, in a hospital setting, for example, you have to take into consideration patient meals, cafeteria meals, and nourishments, which could be supplements or tube feedings. A lot of hospitals use a standard for nourishments, such as 3 nourishments are equal to 1 meal. And a meal equivalent is the amount of food sales divided by the average cost of a typical meal. So for example, a cafeteria meal equivalent would be the cafeteria meal sales divided by the market-based price for that meal. For nourishment meal equivalents, it's the number of nourishments divided by the meal equivalent number for nourishments. And then a patient meal equivalent is just the number of meal trays that were served during that day. And to determine the total meal equivalent, we add all the individual ones, the cafeteria, the nourishments, and the patients together, and that gives you the total meal equivalents for that establishment. All right, and here are our references. Thank you guys. I hope you enjoyed our presentation.